Dental Fuel, the podcast that focuses on what no one else is talking about: mistakes. The dental world is full of before and afters, and no one is talking about the middle. Dental Fuel brings you the unspoken in between. Dental Fuel is brought to you by Doctors Disability Specialists, a team dedicated to helping dentists and physicians with disability insurance, life insurance, and comprehensive business planning. In this episode, we have Dr. Emma Guzman-Vizcarrondo. Dr. Guzman is a general and cosmetic dentist practicing in New York City. She completed her doctor of dental surgery degree at the University of Buffalo School of Dental Medicine and was a general practice resident at Bronx Care in the Bronx, New York. Dr. Guzman currently practices in Brooklyn, and her main focus is changing her clients' life by improving their smiles and ultimately their health. Dr. Guzman is a member of the American Dental Association, National Dental Association, Academy of General Dentistry, and Delta Sigma Delta Dental Fraternity. She is a member of the 2nd District Dental Society New Dentist Committee. She is dedicated to mentoring, volunteerism, and service. Dr. Guzman is originally from Brooklyn, New York, and her parents immigrated from Livingston, Guatemala. She has 5 siblings and several nieces and nephews. She enjoys dancing, cooking, traveling, and spending time with family and friends. Dr. Guzman brings so much energy and passion to our conversation. I know that you'll find pearls in some of the mistakes that she shares with us. Emma Guzman, welcome to Dental Fuel. How are you doing today?
I am doing amazing. How are you doing?
I am so excited to have the opportunity to speak with you today and to share a little bit about your story with our listeners.
Yeah, I'm very excited to be here, and I'm super excited that we get to reconnect since, we knew each other in the land.
Yeah, good old Azalan making connections since way back when.
Yes, absolutely.
Emma, please tell our listeners, where are you right now?
Okay, so currently I am in Brooklyn, New York, and ever since I graduated dental school, I came back to the city. So I was working in the Bronx, I've been in Harlem, I've been in Long Island, I've been in Bushwick. But right now I am settled in the Park Slope area. If you're originally from Brooklyn, we used to call it downtown Brooklyn back in the day, but now it is Coin Park Slope, right across the street from the Barclays Center. And I am the senior associate dentist at 10 Dental, the Park Slope location.
It's super exciting, and I am excited to talk a little bit about Tend. But tell our listeners, are you from the New York area?
Yes, my family is originally from Guatemala, but I was born and bred in Brooklyn.
I love it. So tell us a little bit about Tend. I think that this is a group that several of us have heard about, kind of in the news in the last few years or so.
Yes.
But I'd love to know more about the practice, how you fit into that practice, how you came to find Tend. Tell us everything about Tend.
Okay, perfect. So 10 is what we may know as a dental service organization. So it's actually headed by someone who is not a dentist, but we have a lot of dentists in hand making sure things go the way they're supposed to be. So from the beginning, we had, Dr. Mark Slenoff, which is somebody who is a big name in NYU. He originally was working with the creators of 10 to, make sure they had all their P's and Q's together on the dental side. And then now, actually, Dr. Chris Salerno is the, chief dental officer at 10. So, we very much so are focused on patient care, making sure we're giving them quality care. 10 originally started prior to the pandemic, and they had a few locations, but the pandemic hit, and they really, went in terms of, how we can make this company better, how we could restructure the design and completely revamped. And since then has opened 20 plus locations. So we have 26 locations around the country, and we're actually going into the Connecticut territory next. So we have locations all around New York City, in Boston, in DC, in Tennessee, which is where our headquarters are. And then we're going into the Connecticut area. So the way that the offices are structured, there are usually around 4 to 5 dentists per office. We have 7 plus hygienists, multiple dental assistants, and it's a pretty good team. We have our welcome bar, which would be about 4 to 5 people, which is our front desk. Every studio has a manager, assistant manager that handles all the things that I don't want to handle. And then in my role as the senior associate, I am the lead dentist at my location, managing our junior associates and our associates. The junior associate is someone that is a year or two out of school. Regular associate is anyone after that 2 or 3 more years of experience. So, in my role, I have to mentor besides doing the dentistry and, handling anything clinical. When it comes to clinical issues, when it comes to supplies, things like that, I have my hand in that.
Very exciting.
Yeah.
And, us at Ignite DDS and myself, we are Chris Celiano fans for sure. So it's
Yeah.
exciting to see, his role with Tend.
Mhm.
So tell me, did you go into Tend straight out of graduating from dental school?
Oh, no, I did not. I was practicing. I was in traditional private practice as an associate for many years. I actually didn't join 10 until my 5th year practicing.
Very cool. And how many years out are you?
Next 6 now.
Exciting.
Yes, yes.
We're learning as we go, right? Every year, I feel like
Like,
for
yes.
myself, yeah, I
Yeah,
learned
now
just
it's like
that much
6
more.
years. Oh, like 6 years. I feel old. And we're
No,
still
no.
babies. We're
Yeah,
still
that's right.
babies. We are
That's
new
right.
dentists.
Exactly, exactly. Did you do a AGD or GPR out of dental school?
I did a GPR at Bronx, Lebanon, which is now Bronx Care.
Very cool. And I know
Yes.
that, New York requires PGY1 of some kind.
Yeah.
But if you didn't have to do a residency, would you
Mhm.
have done one?
I think I still would have. I think I still would have just because I feel like dental school just taught us just what we need to do to survive, right? I went to the university at Buffalo, and I believe that they trained us very well. I was very happy with the training I got, especially, once you go into residency and then you kind of see like, oh, okay, I know how to do this. This is how I do that. So I believe we got great training, but there's a limitation, especially in dental school when it comes to the amount of students there are student doctors there are versus the amount of patients, right? So I know like towards the end it's like, oh, I didn't get my bridge requirement. All right, got to do it in typodont. Didn't get my endo requirement. So it's like, did I learn what I need to learn? Yes, but in terms of the practice of dentistry, I didn't get enough practice. So I feel like, you
I
know,
hear you. Yeah.
so I was just like, how do I not do a residency? And there are some people in my class who went straight into practice. Kudos to them. But I definitely think that that year helped me in terms of my speed, in terms of my confidence, because the foundation was already there, right? Dental school gave me that. But when it came to knowing how to deal with patients, dealing with difficult patients, I didn't just have my tier director just say, hey, doc, he he's getting rambunctious. Can come in here with me? It was a little bit more hands off in residency, but you still got someone to back you up. But for me, it was absolutely necessary. At least
Very,
to build that confidence.
yeah, very well said. I feel similarly for my residency. It just helped build confidence, helped me with
Mhm.
treatment planning, helped
Yes.
me ask more questions outside of, hey, outside of that pressure of when we were in dental school where, hey, we just need to get through our requirements so we can
Mhm.
get out of here.
Right. It's like I'm good. It's like, yeah, you absolutely need this amalgam, right? Because I'm
Yeah,
trying to get my amalgam requirement done, And of course, not a disservice to the patients. Amalgam is a great material, but in private practice, would I really be doing that in
right.
residency? Would I really
Exactly. Yeah,
like,
yeah, yeah.
yeah, it's 31. Who cares about the color? you know? So it's like
So,
you remove that requirement aspect. Now it's like, okay, what do you need? Why do you need it? Right? Comprehensive treatment planning. Not saying we didn't learn that. Like, yes, we learned the concept, but when it came to what we did in dental school, there were limitations, right? In terms of time. A
mhm,
comprehensive treatment plan is going to take 4 years in dental school with the amount of time we take to
right.
do our visits, the way things are scheduled, what specialties we want to be in. When you're in residency, now you really start to look at those things.
Yes, 100%.
Mhm.
So, Emma, here at Dental Fuel, we are dedicated to learning from each other's mistakes, and we're here to ask the tough questions about mistakes that we have made in practice. So, my first question to you in your short career so far, can you think about a clinical mistake that you've made and how you managed it?
Yeah. So I have I have one that I would say stuck with me because it was my first like mistake, right? And it happened in residency. And then I have other stories for other things that happen in practice because things always happen, right? And I would say that the mistake was something that happened clinically, but I would say that my mistake was the way I treatment planned it.
Mm.
So, we had tooth number 30 bombed out, decay close to the bone, frication involvement, and I'm trying to be a hero. And I'm just like, let's do the endo. We'll do crown lengthening, we'll do post crown, all these things. The patient bought into it, and I'm doing my endo, and then I cleaned out the canals, and I'm going in with my rotary, and then I start to see blood where I wasn't seeing blood before.
Yee.
And I'm just like, hmm, okay, let's irrigate. Let's irrigate. We're irrigating. The blood just keeps flowing. Let's get an x-ray, right? So, and then I see a nice line right through the middle of the tooth, my first perf. I was distraught. I didn't know what to do. I was just like, oh my God, now the patient's losing the tooth. Like I didn't even know what to do. I left the room. I go to my attending. I explained what happened, and they looked at the x-ray and they was just like, yeah, okay. What are you gonna do now? And I'm just like,
So calm.
I'm close to tears. And they're
Right.
just like, what are you gonna do now? You perfed right through the frication, right? Can we save this? I'm like, I don't know. Let me look for endo. They're like, Emma, can we save this too? I'm like, no. So, it was at the point where then one of the things is that knowing when heroics is not really going to be a service to the patient. One, two, when you do the heroics, knowing that the bad thing may happen, right?
Right.
And it
Right.
wasn't
Yeah.
that expectation. It's like, I know this is a tricky one, but when something like that finally happens, it felt like the end of the world to me. I felt like I ruined this patient's mouth, and then my attending was so cavalier about it. But to be honest, I felt like that definitely made me feel better because they're like, look, you tried to save the tooth, you couldn't. What are the next steps for the patient? And I'm like, okay, extract, bone graft, implant. They're like, okay, so set the patient up for that. See if we want to do it today. And then I'm just like, you want me to go tell them that I perfed the tooth?
Can you help me do it,
And I
please?
can come, and they're like, we're not going to tell them. No, you have to go tell them. Right.
Oh.
So, I had to go in there, have the conversation. And they were just like, okay, yeah, you told me that it was going to be a difficult case. And I was just like, okay, so I'm the only one that's at the point of tears. Okay, cool. So like that situation has never left my brain because it's like everything is not the end of the world. One, two, when you make those decisions to try to do heroics or to go with the option that may not be the most ideal option or maybe the option that has a guarded prognosis, you have to know like how do you bounce back if the outcome is not ideal, if what happens in the chair is not ideal, and being 100% candid from the beginning, right? And I think that that's what saved me in terms of rapport with the patient, was that from the beginning I said how difficult it was going to be. Now, did I go to the extent of saying that the tooth may have to be extracted? No, because in my mind, I'm like, oh, we're going to do endo. It's going to be fine. Right. But I think that that is such an important thing that has stayed with me. Like, I kind of went, especially when we're working on something tricky, before I even touch the tooth, I go in like, look, this may not end how we want it to end. I already sent the prescription to your pharmacy just in case. We have the referral right here waiting for you just in case, right?
Yeah.
So, when it works out, then great. Dr. Guzman did a good job, right? But
Mhm.
when it doesn't work out, we're prepared for what we're going to do next. I have the referral ready for you. I already sent the prescription. You don't have to worry about doing that now. And it doesn't look like I made a mistake, right? It's something that happens clinically. And I feel like when it comes to dentistry, it's very hard for patients to understand that line, right? Whereas it's like, you did something. My tooth didn't hurt before, right? So I would say that that was one of the biggest things clinically that, happened very early in my career. That happened probably 2, 3 months into residency, where after that I had to be like, okay, you have to be very candid with people, even if they might not understand. You need to make them understand to a degree that, you know, when things do happen, and they do every day, if you do enough dentistry, bad things are going to happen,
Mhm.
right? You're going to
It's
have
true.
outcomes that you don't want. You have to be able to manage that. And I would say, just from that, mistake, which is like, is it a complication that could happen? Yeah. But and then after, you're thinking, you're like, oh, was I going too aggressively?
Mm.
How did I end up in the rotation? Like, you start playing back the situation. And as such, mistakes do happen, right? Like, it's a part of the nature of what we do. We see a crown, it looks amazing, then we seed it, we don't push it down far enough, the cotton roll doesn't go down far enough, you see the post op is open. What do you do now?
Yeah,
You and I immediately tell the patient,
absolutely.
look, this is not to my standard. I know it's been 2 visits already, but we're gonna have to cut this bad boy off and do this over
Yep.
again. You
We're gonna
know?
be seeing you again.
Right. Like, this is actually not your last visit,
Yep.
And it's just like, get
Surprise.
right. And
Yeah.
oh, it happens so much, especially, you do enough endo, you're gonna get and now, 6 years later, have I had more than one perf? Yeah. At the initial I don't do as much endo now, but earlier on in my career, I was doing endo every single day. If you're doing endo every single day, you're gonna get a perf, you're gonna get a broken file, you're going to get an over obturation. And it's just learning how to deal with having those hard conversations, right, with the patient beforehand, making sure that they actually read the informed consent. A lot of the times they don't, right? So then when complications happen, it's such a surprise after. And I'm like, did you,
Mhm.
it's that this is
You
listed.
signed it.
This
Yeah,
is
yeah, yeah.
listed on one of the things, right? So sometimes it's like, you have to go over it verbally, right? Even though it may feel like, oh, this is redundant, they already read it. But sometimes you have to do that, just because they really don't read it. A lot of the times they just sign it. And then now, when I tell you, oh, a file's broken, what? You broke a file in my tooth? This is one of the complications of endo. I thought you read it, right? So, a lot of the times I make it my business to either go over the consent myself, or tell the DAs, like, you have to list them out. Like, these are the things that we need to talk about. So when complications do happen, we're able to manage it a bit easier. Is anyone happy when complications happen? No.
No,
Right?
no.
But we're able to manage it a bit better.
Yeah. So two things that I'm hearing here are one, patient communication, huge, and managing expectations, patient expectations and your own expectations as well too, because things can go south. That is dentistry for you. Even though you think things may go one way, they may absolutely take a full turn around and go the other way.
Yeah.
So
And
that's
giving
crucial.
ourselves grace.
That yes.
Like, everything, like any complication that happened, the world is over. I'm a horrible dentist. Now it's like, does it still bog me down? Do I still lose sleep over things? Like, I will lose sleep over a crown delivery that I did not like the way that seated, right? Even though I told the member, even though we took a new impression, I I lose sleep over it,
Yeah.
right? Not as bad as before.
Why
but it
no?
still but it still happens, right? And
Yeah,
it's just
I
getting
think we're
over.
all the same. We just ruminate and replay the day and
Mhm.
nitpick at the millimeters that didn't go right from the day, but it's
Yeah.
hard.
And it's
Dentistry's
just
tough.
like, did they not bite all the way? Did I not press down hard enough? And
Right.
then you're just like, what can happen? Oh, now I gotta block him again for the delivery. And you're
Yeah,
just thinking about all the things. You're thinking about all the things. And you're just like, why did this happen? And then you have to be like, this is dentistry. That's it. Like,
it's dentistry. It's so
it's the
true.
practice of dentistry, and you keep
The
moving,
practice of
right?
that's right. We go to work every day to practice and get better at dentistry.
Absolutely.
I'm pivoting over to a business or financial mistake. What is a business or financial mistake that you have made? in your career so far?
Okay, I would say, oh, this topic. I would say that a big, big financial mistake is not knowing my worth,
Ooh, that's a good one. I like
right?
this. Mhm.
Not knowing my worth as a young dentist, a new dentist, a woman of color, right? And essentially, in the beginning of my career, now, aside from like the scary practices that you go in and you're like, I definitely can't work here, right? But just taking what they offered,
Yep.
right? Like, now, okay, this is the standard. The standard when we graduated, at least in New York City, okay, $500 a day. If you were offering me $500 a day, okay, I didn't negotiate anything else. I
Mhm.
didn't. I then asked to be W-2 because that's another thing too, right? All these little things that they're telling you in senior year of dental school in residency that you really don't understand because you're not in it. When they're just like, don't let them make you do 1099. It's supposed to be W-2. And you're just like, I don't even know what you're talking about, right? And then when you go and they're like, okay, here's your 1099. I'm like, yeah,
Where do I sign?
I feel like I've heard about this before, but I don't remember why I'm not supposed to do this. Oh, $500 a day? Okay.
Right.
Here's my 1099, right? And and that's kind of how it was. A lot of the places in the city, and I've been practicing for 6 years. It wasn't until I was at 10 where I was W-2. So it was like I've always been 1099, where essentially, am I really 1099? Am I carrying my equipment to that office? No. But it was essentially accepting whatever you were offering me, right? Having conversations in the beginning when they're saying, okay, we're going to do $500 a day. And then, in 3 months, we'll visit getting paid off reduction. Cool. Right. Then it's 9 months later and we've never had that conversation. And then I'm also not bringing it up. Right. So things like that where I'm losing out on money. Right. Because I'm
Mhm.
looking at my production and I'm like, I produce way more than the $500
Right.
a day. But who am I to say anything to my boss? I just graduated from school.
Mhm. Mhm.
So for me, and it's just like, and I never thought about it until I read the questions, and I was just like, what would be as me not being a business owner? I'm like, what would be a financial mistake? And I'm like, not knowing my worth because there's been too many conversations where I've had with my colleagues, graduate the same year as me, like, wait, what percentage are you getting paid? Oh, 30. Is that not normal? Is that not what I'm supposed to be getting? Same year as me asking for exactly what they want, telling their bosses exactly what they want, getting insurance, having all these things. And I'm just here like, thank you for my paycheck.
Right. Yeah.
Like
I
I'm not working for it.
Yeah, I resonate so much with that because so I'm at a FQHC and I have a commitment that I had to do with public health and I needed a job. I mean, I applied everywhere. I was having a really hard time to get a job. And so pretty much the first one that bid, and thank God it's been a great place to be. But the first one that they were like, here, this is what we're offering you, you in, you out. I was like, I'm in. Instead of taking a step back and being like, hey, let's negotiate a little bit. Is there any wiggle room? I bring this to the table, XYZ. I think that now if I were to go somewhere else, the conversation would be different, I would hope. But I completely resonate with what you're sharing with us today.
Yeah. Yeah, and even it's still hard now, right? It's where I know it's like I'm playing back, okay, like this is how much I'm gonna ask for, right? And then you get there and you're just like, oh, what are you offering?
Right.
And it's just like, I don't know what it is. And it's just like not used to doing that, right? I was just like,
Right.
it wasn't a thing. Like people never spoke about money in my household, right? Like that's kind of weird. Why are we talking about money? I don't know how much people make. Like it wasn't until I was older where I have my other colleagues who are just like, "Oh yeah, how much you getting paid?" And I'm like, "We're talking about money.
Yeah, that's still
We're
kind of weird for me, but
yeah,
yes.
we're allowed to do that."
It should be talked about.
And it wasn't until my current position where I told my girlfriend that I was applying, and she's like, "Ask for this much," and I was like, "Oh, so much." I was like, it's so much, right? So then me playing myself, like I asked for a little bit less than what she said because I felt like what she said was too much. And they're just like, okay. And I was like, wait, no, actually this. And they're like, no. They're like, no. And I'm like, that was so easy. I should have asked for more, right? Because then now when you try to negotiate, they're like, you already said your number. You said your number first.
Right. Yeah, you showed your cards. You
Right.
showed your cards and they were too low.
Right. And even one of my other jobs that I initially applied to, and this was maybe I was about a year out, he was just like, oh, okay, what would you like to get paid? And I was just staring at him. I know, what do you usually pay your associates? Like, I don't even know how to respond to that. And that was because I don't want to say a number that would sound disrespectful to my boss, potential boss, or sound like, who's this new doctor coming in thinking she could ask for whatever she wants? But that's totally in my head because people do it every day. Right. So I would say that's a huge financial mistake because I know I lost out on money those first 2, 3 years I was
Oh, absolutely. I completely agree with that. So for our listeners, know your worth,
practicing.
ask.
Yeah.
The worst they can say is no. You likely
Right.
won't offend them, but it would probably lead to a dialogue and a conversation, and perhaps you'll
Yeah.
get some feedback on better ways to ask in the
Yeah.
future.
Absolutely.
So, Emma, I know that you're at 10 now, and you said you're a senior associate. Is that correct?
Yes.
Very cool. And you are managing a large team, is what it
Yes.
sounds like.
Yes.
Building a team is huge and really crucial to the success of everyone's daily work. What mistakes have you encountered when building up this team? And what pearls would you give to our listeners to help overcome different struggles or mistakes or, anything that you've encountered that you've had difficulty with your team?
Okay. I would say do not let things linger.
Mm,
When there's an issue that needs to be addressed, address it immediately. And I would say that has been my biggest difficulty. Whereas I want to make sure, I get all the facts and I'm researching and I'm talking to multiple people. And then by the time I go to address the situation, it's either irrelevant because it happened 3 weeks ago. And then now it's like, now it sounds ridiculous to bring it up now because people don't even remember what I'm talking about. Or it's like, two, it has become so much bigger than it was, right? Because especially when you have a big team, you work with a lot of people, what ends up happening is the telephone game, right? Dr. Guzman said this, and then by the time it goes to the fifth, sixth, seventh, eighth, ninth, 10th person, it comes back. Dr. Guzman trying to get me fired. Wait, what? I just asked why I didn't come in today. You know what I mean? So I would say 100% my biggest pearl is don't let things linger because I I don't like conflict. I don't like conflict. I tend to avoid it. And that is one of the biggest things that you have to deal with when you're managing a team. There's so many people, there's so many personalities, there's so many ways that people could perceive things. There's a lot of emotions involved. Dentistry is high stress. Dentistry is very high stress, and it's not a comfortable environment to work in if people are not getting along, right? So it's super important to nip things in the bud and very quickly handle the situation. And knowing your team, knowing the personalities of the people in your team, knowing when is the right time, because maybe you have to give people 5 minutes or even an hour, right? Before you address it. But do not make the mistake that I made before and you address it 3 weeks later and people are like, what are you talking about? Like, I'm not upset about that. And I'm like, but I know you were upset 3 weeks ago. And they're just like, okay, I'm not
yeah,
even thinking about it anymore.
I hate confrontation. It is
Hate
very
it.
difficult. Yeah, difficult for me to manage. I avoid it. Ugh, it just gives me the ick, I
Yeah.
guess that's the best way to say it.
Yeah.
But it's so important, especially in a leadership role as a lead dentist or, even if you're an associate dentist, to learn to help manage a team and to have those tough conversations. I think that it helps you build yourself up more as a dentist, but also as a leader in front of your team.
Mhm.
Emma, have you felt as a new dentist that people have been receptive to your leadership?
Hmm. I would say, I would say yes, because of my demanding personality. And how at times, I could be bold, I say it how it is, I project my voice, I command the room, right? And I say because of that, they respect it. Because I have seen, with other associates who, may be a little bit quieter or, not as bold in the way they speak, that they're kind of like, oh, yeah, the other doctor. And I'm like, no, that's Dr. So and so. Let's show some respect, at times, addressing the doctors by their first names. Absolutely not. So I think that I demand and command that respect. So it's never really been an issue for me in terms of people receiving that. And I think because of that, I also, when it comes to the confrontation aspect, I try to manage how I'm perceived, because I'm like, I also don't want to be too aggressive, right? I want to make sure that it's being received well so that they can learn and grow from
For dentists who struggle with that,
it.
what advice would you provide to them?
Whew.
How can they make their presence be known?
Yeah. One, I would say it starts in the chair, right? It starts in what we do, right? If you have confidence in your work, you're doing great dentistry, your team is going to see that and respect that, right? You have to lead by example. You can't tell the team to be there 15 minutes early when you show up 15 minutes late, right? There's certain things, if there's, practices that you're setting in the office, you have to lead by example. Because the one thing that you don't want to be is a hypocrite, right? You don't want to say, oh, you have to do this, you have to do that, but you're not doing it yourself. So that's the first thing, right? You have to lead by example. Let your dentistry prove who you are as the lead dentist, right? Prove who you are as a member of that team, right? Give give your team members, like, you have to allow them to buy in, right? Give them, a stake. Give them a stake in the office, right? Like, oh, you want to learn how to do this? Let's get a rep in to teach you, right? You're interested in that? How could we how you like technology? Let's see how you could help manage the office page, right? You have to have the team buy in, right, to what you're doing and what you stand for, and then you'll be able to command the room, right, after the fact. Where it says like, all right, Dr. Guzman is speaking, so
We're
everyone,
going to listen.
let's pay attention, right? But it starts with the dentistry, and you have to lead by example, and your team has to buy in.
If you could provide advice to our listeners who are dentists, what would be the greatest piece of advice you have to offer?
Hmm. What's the greatest piece of advice I have to offer? Absolutely know your worth. That's my biggest thing. Know your worth. Take CE early. Take a lot of CE. Keep learning. But I would say my biggest thing is get a great mentor. Get a great mentor that practices the way you want to practice, or who could lead you in the right direction and that has the resources for you. Because I will say I see a lot of dentists that are unhappy just because they're not in the right space. Right. I've seen some of my colleagues at the verge of saying they're going to quit dentistry, and then they get the right mentor and now they love it, right? Because they just weren't practicing the way, they want to. And a lot of the times, especially as new dentists, early in our careers, we don't have the opportunity to practice exactly the way that we envision. Right. So it is daunting. It is hard. We have, these numbers behind us with our student loan burden. We're trying to figure out, like, how do we navigate this world as someone with esteem now, right? I'm a doctor, but I have to manage myself, my family, my patients, the team. There's so much things going on, and it could get daunting, right? Especially if you're not practicing the way you want to practice, right? Especially if you're not making the money you think you should be making for all the hard work you're doing. So I would say get you the right mentor that could lead you in the right direction and let you know, we can only go up from here, right? I feel like a lot of the times, especially now with social media, where you see all these super successful dentists doing all these things. I have friends who like had to disconnect their IG because they're like, it's too much to see these cases, right? a lot of the times, like, these dentists are 10, 15, 20 years
Right.
in, and
Right.
they're
They've
very
put
much
their time
well
in.
established, right? You're
Right.
like,
Yeah.
why does she only work 3 days a week? And I'm like, yeah, she graduated when I was in middle school. Like, she's allowed to work 3 days a week. You know what I mean? So it's like we have to like give ourselves grace and get a great mentor to see us through.
Very well said. Yes, I couldn't have said it better. And are there any CE courses that you have taken that you recommend?
Let's see, what have I taken? So during the pandemic, I did the aesthetic course that was managed by NYU. They did like Zoom courses and it was like a 10-week course. Yes. They also have their in-person courses. Now I didn't end up doing that because the pandemic hit. But one of the courses I do plan on taking is the Aesthetic Advantage course. That's also an NYU course. I've taken implant courses. Hands on is key, I would say. Hands on is key because we take in so much information, but any hands on course, anything specifically, I can't point out one right now just because it's like, it depends on what interests you, what you like to do. I've taken hands on endo courses, implant courses, all these different things, but it really depends on what interests you. But I would say take hands on courses, right? A lot of the didactic material, you take all the different courses, essentially they say the same things. But it's getting these hands moving and giving you the confidence to do it, right?
Yes.
A lot of the things that they're saying in these courses is not things that we don't know, right?
Right.
So that's why I think it's very essential to take hands-on courses to really get you going to do certain things and give you the confidence. Like I took an implant course in North Carolina with Dr. Phelps. And literally in the next 2 weeks, I had implants on my schedule, right? And this was probably the fifth implant course I took, except this one was hands-on, right? So now I'm like, I did it in someone's head, right? I did it on a real life person, right? There's but so many type it out jaws that you could do it on, right? And it's just like, no, like I did it on a human and they didn't explode. It's
Right.
like
Yes.
that gives me the
They
confidence.
survived.
Right,
Yeah.
right. So that gives you the confidence to be like, okay, like I could offer this service to my patients, right? I don't have to send them out. Now, case selection is key, right? There's still certain cases that I'm like, that's going to the surgeon, but doing it on a human there, with guidance definitely help, especially because when you get out into private practice, and I would say this was something I noticed as well, is like the group setting, unless you specifically go to a group practice, it's not really what's happening in private practice, right? There's one or two doctors, and if you're a good enough associate, the owner kind of disappears. And I know that has been my experience where they're like, okay, you're producing enough, and they like slowly are not in the office anymore. Or it's their schedule is fully booked, your schedule is fully booked, mentorship is not really happening, right? Or it's happening during lunch, or it's just, small little conversations. But if you don't know how to do implant, okay, they're doing it, right? If you don't know how to do something, someone else is doing it versus it's like, okay, we're going to sit down and we're going to do this case together. Unfortunately, that's not productive, right? So you go see your patient, I'm going to go see my member, and then maybe we'll talk about it later, right? And that's what ends up happening a lot. You're in the offices by yourself, so you're not doing the things you don't know how to do. And there's but so much that someone could lecture at you about when you're not actually doing it with your hands, that you're like, yeah, that was a great lecture, and I'm going to go still have my regular, schedule that I have on
Yeah. Hands-on is great because, like you said, you're
Monday.
kind of going through the motions, but you also get the feedback and
Yeah.
you can ask questions in person,
Yes.
and you likely are going to create some kind of mentorship with whoever,
Hmm.
held that course where you can still ask questions, which I think is key.
Yeah.
So great advice. I love it.
Yeah.
Any last thoughts that you would like to share with our listeners?
I would say to all the new dentists, just keep listening to all these different podcasts, right? Even if you don't know these people in person, these are your virtual mentors, right? Keep hearing the stories. You are not alone. Dentistry is a very, very difficult field, but it's rewarding, right? practice how you want to practice, right? And make the best out of it.
I love it. Emma, thank you so much for your time. If our listeners would like
Having
to if our listeners would like to connect with you, where can they find you?
So my Instagram is underscore Dr. Emma. So you could definitely DM me and hit me up there. Via my website, there's a link there where you could contact me if you're interested in mentorship. And then my email is my first name, last name. So Emma Guzman 226 at gmail.com.
Go check out the website. It is awesome. I love it. I'm a
Yeah.
fan. Emma, thank you for bringing your energy to our episode today, and we'll catch y'all next time.
All righty. Thank you.
Be sure to connect with Dr. Guzman on Instagram at _Dr.Emma and with Ignite DDS at Ignite DDS.